All right, we're going to our other story now, but what you're seeing on the box just at the bottom of your screen, we're showing you visuals coming live from Pretoria, where the Tripartite Alliance, that's the ANC, COSATU and the SACP, rather, are marching to the Kgosi Mampuru prison. This is against the parole of Chris Hani's killer, Janus Valus. But let's go to this story in the meantime. Almost 14% of the population, or just over 8 million South Africans, are living with HIV. And KZN has the most infections in the country. Ahead of World AIDS Day tomorrow, what is the province going to educate people and tackle the virus? Nqobile Madlala is finding out, and she joins us now live just to give us more details. Nqobile, tomorrow, of course, the entire globe commemorates World AIDS Day and remembers all those who've passed on to this particular illness. Give us some of the things that the young people in KZN are talking about when it comes to protecting themselves from contracting the virus.
Well, Masego, what we've done is we've spoken to some of the activists on the ground. In fact, we're speaking to Treatment Campaign, and they were telling us that what's very important is that people need to not default on medication. This is very important, especially if you've already found out that you have the virus. So these are some of the things that they're telling the community to look at, the young people. But at the same time, they're emphasizing that it's important for one to know their status and continue to live, whether they are positive or negative, and seek help when they need help. But of course, I want to bring in some of my guests now, Masego. The lady that joins me now is a young woman. I mean, you found out about your status much later on in your life, but you have been the champion and some of the people that have been in the ground speaking to young people. Explain to me how you do it. How did you accept your status? How do you go forward as a person, as a young person?
Okay. I accepted my status with the understanding that I'm anointed. I'm anointed by God. Me sharing my story with others will make a difference to them. And me sharing my story to others is a weapon to make them feel that they are not alone. There's someone that who can always help them. And also I myself do go some situation, and I also have somebody who also helped me along the way. So I always tell abantu abasha that it's very important for them to know their HIV status and to stay on treatment. And also to those who are HIV negative, there's nothing better than abstain. And also to make sure that you use preventions, condoms, PrEP, and everything that is there for us, even though the health facilities are not providing as much. But now, since we have TB and HIV care, they are providing us with a lot of information and with a lot of guidance toward us as people living with HIV. And also they are preventing other young girls who are HIV negative to stay negative, and also to make sure they know what they want in life.
My angel, I understand, like you're saying, that it's important to arm yourself with knowledge. Do you feel enough has been done to perhaps fight the stigma and to perhaps get the community to understand what is HIV and AIDS at this point?
At this point, I feel there's a lot of work that is need to be done. I feel like a lack of communication and a lack of understanding to what the people are knowing with HIV. Remember, when you go to township, people have their own myths and their own beliefs toward HIV. So as we are the HIV activists, we are going to the ground and educate people fully about what is HIV and the stigma. The stigma in the community is there, and it's been there for many years. So you as a person who are living with HIV, you need to put yourself together with the people who acknowledge you and who do not judge you because of your situation. And also you must always prepare your mind. People are always going to talk, but you shouldn't give up your life because of someone said what about you. It's very important to know yourself. Yes.
Thank you very much. I want to bring you in, Mama. You also chair people living with HIV and AIDS, of course. I imagine this is a difficult journey for many people. They don't just wake up and accept. Tell me, what can the province do to ensure that people can understand and can be able to live their lives?
Okay, I think as a province, we need to make sure that we scale up our response. Go back to basics. move to a point where previously we had lay counselors in the clinics, where when you test, you get counseling, proper counseling. Now it's just, I think we're more in pushing numbers, pushing the targets, saying we want to reach this 95, 95, 95. And we forgot that behind these numbers there are people, actual human beings, who had feelings that they are dealing with, who had issues at home that they are dealing with. So we need to start going back and say, let's bring back the lay counselors, let's bring back support groups, and let's go back to a point where we had Operation Sukumasake, where we had community healthcare workers who were going household, profiling families, finding those missing kids, finding those child-headed households, and then bringing back those kids back to care and making sure that those young mothers are taken care of and they understand why it is important for them and for their kids to take medication.
The province is going to be commemorating the World AIDS Day, which is tomorrow. How would you say is best to commemorate this day?
The commemoration will be tomorrow at Amajuba District in Danhauser, starting at 10 tomorrow. And it's going to be a huge event where the Premier is going to be there giving out speeches. But for me, as a person living with HIV, I don't feel the speeches are going to do much difference. What's going to do much difference is for us, as a province, as Department of Health, the partners who are working with the Department of Health, to go down together with us, people living with HIV, go down in the communities and start profiling those families and start bringing back those people back to care. Have a mobile clinic, have a sister there, have a social worker there. We go down to houses, we found a person, we initiate the person on the ground, and we bring that person back to care. We provide counseling. We link that person with a support group and make sure that this is sustainable, not just a once-off thing, but a year event, not just an event that happens on the 1st of December, but a yearly event that happens every day for the whole year.
Thank you very much. Thank you very much for speaking to us. Well, Masego, I think the sentiments there are very clear. They're saying that back to basics is the way that you can win in fighting against the infections that we are seeing rising as well in KZN.